day everyone. So in this video we are going to discuss about what are the safe drugs in the pregnancy. So before going to discuss what are the safe drugs in the pregnancy, I will discuss with the mnemonics. So first we have to understand the joint national committees JNC 8 guidelines. So first we have to understand, according to the JNC 8, what are the how they categorize the hypertension. So it categorized that the hypertension it's categorized as if the blood pressure is greater than or equal to 140 over 90. It means the BP, if this systolic or diastolic, any of them will be more than, if the systolic will be more than 140 or diastolic will be more than 90, it will consider as hypertension according to the JNC 80 guidelines. So if suppose the suppose if the BP is 150 over 80, in this case we can see the 150, the systolic pressure is high, even it will consider the hypertensive. And also in case of the in another case, if the suppose it will be 130 over 100, we can see here the diastolic is 100. So according to JNC, it will also considered as the hypertension. So now we understand the what is the hypertension according to the JNC 8. So let's let's discuss in a brief what are the how they categorize in the hypertension. So first we have to understand what is the normal. So normal blood pressure according to the JNC is systolic should be less than 120 and diastolic should be less than 80. And the pre-hypertension should be the BP should elevate 120 to 139, and the diastolic blood pressure should be 80 to 89. And for the actual hypertension, the BP should be greater than 140 of systolic and greater than 90 of diastolic. And also the JNC 8 categorized the BP, the hypertension, in category grade 1 and the grade 2. So how we can differentiate the category 1 and category 2? So grade 1 hypertension, grade 1, if the BP is 140 to 159 systolic and the diastolic will be 90 to 99. And for the grade 2, the systolic should be greater than 160 and diastolic should be greater or equal to 100. So how the GNC categorized hypertension also in case of the pregnancy and also in case of the other general condition. So let's go ahead. Now we will discuss the what are the first line drugs in this condition. Then I will also discuss the drugs used in the pregnancy. So let's start with the mnemonics. So the drugs used in hypertension. So the first will be the first line drugs used in hypertension, and later I will discuss the safe drugs in the pregnancy. So because it's necessary to know what are the drugs first in the general condition. So in this condition we can remember the drugs as mnemonics A, C, D. I am discuss. This is all about according to the basis of JNC8. So A means the ACE inhibitor, and the C means calcium channel blocker, and D means diuretics. And in case of the diuretics, mostly we in the diuretics we use the thiazide. This is the drug of choice in the general in the hypertensive patients. So let's discuss for the pregnancy. Drug of choice in pregnancy. So I will discuss in the both in the two way. The first way will be how the JNC8 recommended the drugs in the pregnancy, and in the second I will give you the standard book guidelines, the how the Harrison recommended the drugs in case of the pregnancy. So in case of the pregnancy, suppose the pregnancy according to the JNC. So first JNC8. So in the pregnancy they first recommended the methyl dopa. This is according to the JNC, and I will also discuss the according to Harrison, what they recommended according to the Harrison. So, and if the patient came in the emergency condition, so hypertension, emergency in pregnant woman, so what we will recommend at that time, it's the hydralazine. Hydralazine is the safest drugs when the patient comes in the emergency condition, and normally the patient has the hypertension. As we discussed above, we prefer the thiazides diuretic. If the patient came with the hypertension in this I am going to tell about the all patient, not only in the pregnant. I am telling in the general condition. Hypertension, emergency in general condition, then we will give the nitroprusside. According to the JNC8. And but for the Harrison, this is the very standard book, so we have to also know about this condition. In this condition, the Harrison recommended the first line drugs for the pregnant hypertension in the pregnant woman is labetalol. It's orally, it can give the orally. But in case of the hypertension in the emergency case, we have to give the same drugs, the labetalol, but it should be given IV. So we have to notice, we have to look this, the IV and the orally. This is the difference here by the Harrison's. And also according to the Harrison's, the hypertensive in the general, no, all the condition they also recommended the thiazide. So there is no any different in according to the Harrison and the GNC8 in case of the hypertension. And in case of the hypertension emergency in the general condition, they recommended as this is the according to the Harrison, the nicardipine. So these are the drugs used in the pregnancy in case of the hypertension. And the better method to memorize the drugs used in the pregnancy as a mnemonics. So just I want to write here the one of the very famous mnemonics, like better mother care during hypertensive pregnancy. So these are the mnemonics. So how we can remember the CPS drugs? I want to just discuss in the brief this one, so we can understand what will be the CPS drug. So B, here no BET, it means beta blocker. M means methyl dopa. This is very good method to memorize the drugs used in the pregnancy. C means clonidine. And the D means dihydroperidose. Dihydroperidose. And the H, hypertensive, means hydralazine. And the P, pregnancy, means parazocin. This is the alpha blocker, so we can give the alpha blocker also in case of the pregnancy. So these are the drugs, no, these are the drugs which is very safe in case of the pregnancy. If there is no any contraindication, we can prefer. This is the very important and very safest drugs in case of the pregnancy. If you learn something from this video, please subscribe my channel so I can further make another video, the detailed video on the hypertensive and the drugs used in the hypertensive in the pregnancy. So thank you everyone.